Coronavirus cases in jails continue to heighten concerns over the spread of the pandemic within confined quarters. In fact, New York City Mayor Bill de Blasio announced that 23 low-risk inmates will be released, all older than 50 years old, another 200 being considered for release now as well.
Former medical director of Correctional Health Services at Rikers Island, Dr. Jonathan Giftos, joins us now to discuss what major health consequences are at stake. First of all, thank you for being with us. I want to ask you, what's the major threat right now, the virus, to inmates in these jails?
Hi, good morning.
Good morning.
Jails, unfortunately, cannot. Can I start?
He's still listening to the question you asked.
Yeah, we're on a bit of a delay. Go ahead.
Jails, unfortunately, cannot protect patients and staff from a viral pandemic affecting the city. They're not closed systems. There's thousands of people coming and going every day. Mitigating factors such as physical distancing and hand washing are impossible in correctional settings, and jails and prisons typically house people at much higher risk of complications of coronavirus infection. In particular, Rikers Island has almost 1,000 people right now who are over the age of 50, which puts them at a much higher risk of complications. The federal jail in Brooklyn has over 500 people that are thought to be at high risk of complications of coronavirus infection. It is simply impossible to adequately screen and isolate people who are symptomatic to protect other people in custody as well as staff and healthcare workers. It's my view that the only way to prevent the rapid spread and serious harm of infection in correctional settings is through depopulation, which is specifically to release as many people as possible to the community to continue their cases with a focus on those at highest risk of complication.
So, we're going to talk to the mayor about that coming up in the 8 o'clock hour. But let me ask you a question about medical staff on Rikers Island and within the city jail system. Do they have enough staff to handle the cases that we're seeing rise now within city jails? And what about supplies in terms of masks and things like that to keep them safe as well?
I think across the city we're seeing healthcare workers that are going to, eventually be exposed themselves, and they're going to have to call out and self-isolate to protect others. Staffing in correctional settings is already very thin, so correctional settings are going to struggle perhaps more than others to adequately staff to keep people safe. In addition, the complications of coronavirus infection, specifically respiratory failure, which requires a ventilator, those services do not exist in correctional settings. So all of those folks who are exposed and that might have that complication are going to need to be transferred into community hospitals, where there's going to be a significant competition for resources over the next few weeks as we see the cases begin to rise.
What about managing detainees who feel like they're at risk, right? And they want to be released because they don't feel safe there. How do you manage that? Because some may be granted that and others maybe not.
Yeah, I've spoken to some of my colleagues that are still working in the jail system now, and they're telling me that the atmosphere is very tense. There's a lot of anxiety amongst patients, amongst officers, amongst healthcare workers. The model within correctional settings does not allow for physical distancing. It's very difficult to keep people separate one from the other. Officers have to escort people by holding their arm down a hallway. People typically line up very close to one another for things like commissary or to eat,
right,
or to be brought into the clinic where they sit in very small pens. So that physical inability to physically distance oneself, plus having no autonomy or control, creates a very, very anxious environment.
Doctor, we have to go, but just quickly, only 10 seconds left. I got a text message this weekend from a correctional officer who said there is a surplus of 195,000 N95 masks in a closet somewhere on Rikers Island. Is there any truth to this, that there are masks there that could be used in healthcare facilities?
That's an enormous number of masks. I can't speak to the specific supply issues there, but if Bellevue Hospital and other hospital systems are running short on supplies, I would not be surprised if jails are as well.
Understood. Okay, thank you so much. Appreciate it.
Dr. Giftos, thank you so much for your time.